also talk about hormone replacement therapy. Like, how do you counsel your patients, a patient with an autoimmune disease, MS or something else? How do we counsel somebody when they
Well,
ask?
of course, it's been up and down because of the confusion about the Women's Health Initiative, the study that purported to show that women that got hormone replacement had more cancer. And so all doctors kind of shied away, not all doctors, but most mainstream doctors kind of shied away from doing hormone replacement. I'm not against hormone replacement at all for a woman with symptoms or a woman with osteoporosis. I think it's very worthwhile. But I'm really careful when I do that. I want to make sure that she's not just taking hormones and that's the end of the story. Here's your script, you know, uh, here's your estrogen patch. And I never use Provera, which I think is a real medroxyprogesterone is a really toxic substance that should be off the market. I have no hesitation saying that. And that really was borne out in the WHI study, right? So don't do that. Use natural progesterone, which has some anti-inflammatory properties. And don't think that the whole story is take estrogen and you're done. So first of all, you're using the estrogen, just to clarify, to treat symptoms, hot flashes, dryness, mood disorders. Sometimes it can be miraculous.
Yeah.
I think the New York Times and the Washington Post both had articles about this recently where they were saying, wow, a lot of women have just been told by the doctors, you need to suffer.
Right.
Right? It just, I mean, they didn't say that you need to suffer, but they just said, too bad, honey. You don't need these hormones. They'll give you cancer, and that's the end of the story. I don't think that's true. But I do measure those estrogen metabolites. I like to do that in almost every woman I put on hormone replacement. There's a simple urine test that you can do that uses dried urine that's not expensive, a one-time test, and it can determine whether it's safe to proceed with estrogen replacement. So you use the lowest, so you treat symptoms, mostly treat symptoms, use the lowest possible dose, and then you make sure the whole system is healthy, right? The brassica, eat brassica vegetables and curry and berries and all the things that we've talked about. Those are all really important.
Yeah. So that whole lifestyle approach really goes a long way. Like, it'll just kind of hit on every system that we've discussed. So